is Charmaine Johnwell, and I'm going to be demonstrating tracheostomy care. I'm going to start by entering patient's room, closing the curtain to provide privacy. I'm going to perform hand hygiene. Hi, Mr. Smith. My name is Charmaine Johnwell, and I'm going to be your nurse today. Can I go ahead and get your name and date of birth? Okay. I verified 2 patient identifiers. Okay, Mr. Smith, today I'm going to be performing tracheostomy care. Is that okay? Okay. So I'm going to start by raising my bed to a comfortable working height. I'm going to place my patient in Fowler's to Fowler's position. I'm going to oxygenate and suction if needed. I'm going to go ahead and set up my supplies. I'm going to remove my gloves. I'm going to go ahead and put up my sterile film. Okay, I'm going to go ahead and dump my supplies in my sterile field. Okay, and once I have my supplies in my sterile field, I'm going to go ahead and fill each section with normal saline to sterile saline, and in one of the sections I can put 1-to-1 peroxide solution as well. I'm going to go ahead and put on my gloves. So ideally I would have another nurse to help me, and I would task them to just holding the cannulas, the trach, so that the cannula doesn't dislodge or come out. I'm going to unlock and remove the cannula, and I'm going to place it in the solution. So once I place it in the solution, I'm going to go ahead and discard the soiled dressing. I'm going to put it in my glove and discard my gloves. I'm going to go ahead and perform hand hygiene once again, and I'm going to put on my sterile gloves. Okay, so I'm going to go ahead and discard that. I'm going to go ahead and organize my supplies. I'm going to place my swabs in the solution. I'm going to clean my inner cannula, making sure that there's no secretions or debris, and I'm going to go ahead and discard the brush, and I'm going to rinse. I'm going to rinse my cannula, then I'm going to replace it. When I replace it, I'm going to make sure that it is locked and back in place. So once I got it locked and back in place, I'm going to take my swab and just clean around the skin and the stoma to about 10 to 15 inches. I'm going to also be making sure that there's no signs of skin irritation or infection. And I'm going to also be making sure that I clean the flange as well. Alright, clean the flange. Okay, so once I've done, once I've cleaned the flange, I'm going to go ahead and replace the dressing. Okay, and once I replace the dressing, I'm going to go ahead and remove the tie. And I'm making sure that I'm holding the cannula so that it's stable. I'm going to be doing the one tie method. And after I clean my stoma, I'm gonna also make sure that I dry the area with my sterile swab. With my sterile gauze. And upon replacing the tie, I'm going to be doing the one tie method, but I'm going to make sure that there's no knots or kinks so that when it is tied, it doesn't cause any irritation on the neck. Make sure that his dressing is in place. So I'm gonna tie the knot, and I'm also gonna make sure that it's not too tight. It's about 2 fingers, about 2 fingers width. And then I'm also going to put a gauze over the knot. And if I have tape, just make sure that the tape, if I tape it, just make sure that the tape isn't like on the skin. Okay. we could trim the tie if there's any excess. So I check the tightness. So I'll replace the oxygen, place my patient in a comfortable position, make sure that the bed is back in its lowest position and it's locked. I'm going to go ahead and discard my supplies. I'm going to go ahead and discard my supplies. I'm going to discard my gloves, perform hand hygiene, and document my procedure.